It may have been. It may have been a New Yorker article that it was the Arkansas system got thrown out in like 1970, I think.
Well, so
and it was deemed cruel and unusual punishment, if I read that correctly, right?
So Arkansas, I'm writing a book called Impermissible Punishments, which includes whipping in Arkansas as well as prisons now. And Arkansas used to whip its prisoners. And 3 federal judges in 1965 and 67 said, you can do it as long as you provide some procedural protection. In 1968, when Harry Blackmun was still on the Court of Appeals before he went to the U.S. Supreme Court, he wrote the opinion saying corporal punishment's unconstitutional. Mm-hmm. And in 1970, for the first time in American history, a federal judge sitting in Arkansas said the entire system was unconstitutional as a dark and evil place, and issued a series of reforms. By the way, it was race segregated too, just to be clear that when we're talking prisons, we're always talking race, we're always talking gender, class. White and black prisoners were whipped, and it was horrible for everybody, and blacks were disproportionately whipped and disproportionately incarcerated. So then as now. But the saying it's horrible, and then there started to be engines of reform, but the cases to which I just adverted earlier started closing the lid on the kinds of reforms. The cruel and unusual punishment clause could then and could now be read to say, you can't do this to people. The key about COVID, which it just needs to distinguish, is some cases say the conditions are no good, fix the conditions. And that assumes that the people are lawfully there. What COVID does is it takes a lawful conviction and, in my view, turns it into an unlawful detention, because no one has the power to sentence these people to risk of disease. Indeed, the cruel and unusual punishment clause says you can't do that. So what we should understand is that COVID claims actually say you can't keep the person there. There are provisions in the law, there are including provisional remedies, something called enlargement or bail, where people could be temporarily out as well as permanently out. But the goal is you've got to lower the density if you're going to make it even plausibly safe for the people who are there.
Professor, I have a follow-up question. It sounds like we have to back, but I'm wondering if you could speak a little bit to the types of the COVID infection rates that we are actually seeing at detention facilities, because I feel like I've seen numbers so I've seen that 90% of the hotspots in our country are in detention facilities, and that also there have been over 1,000 deaths in facilities across the U.S. So I'm wondering if you could say a little bit more about what is the scale of what we're looking at.
So we need to underscore detention means ICE facilities as well as jails as well as prisons, and there's military, but we're focused on those forms of detention. And when we look at those detention, the New York Times ran a review of the clusters, and in early July it was 80% prisons and jails, and then followed 15% meat packing, and then there was the aircraft carrier. And so there was a list, and the important thing is to say it's around the country and it's federal and state. It's not like there's some safe place at the risk and shout outs after COVID came into being, and your other guests are examples of a remarkable community that took all their time and energy to try to lower the risk and keep fewer people in harm's way. And that meant lawyers and non-lawyers around the United States were working to lower the density. Research from a group based at UCLA, including a new law student at Yale named Caitlin Parrish, and as well as professors Brendan Soloner and Julie Ward and others, did research and found that prisoners were multiple times, 3 times more likely to die and 5 times more likely to get the disease. And it's not, they did the documentation, but it isn't hard to realize that if you stick people together, given that we're told to stay apart, of course this has to happen. And it's also important, and there's a wonderful group called The Men run by Dr. Bree Williams out of the University of California, San Francisco, who's always trying to help people see. She does healthcare. Medical quarantine is not solitary confinement. Now, one of the things the Lyman Center does is it looks at along with working with the leaders of correctional organizations around the United States to document the numbers of people who are in solitary confinement. And as of last summer, there were, our best guess is between 55 and 62,000 people in the United States, or roughly depending on the facility, 3 to 10% of its population was in solitary confinement. That is not quarantine. And there is a way to keep distance that is not eating all your meals in the same place and total isolation, which is very disabling, as has been documented by many. So I can send your listeners to websites, Amend, UCLA, COVID Project, many, Lyman Center, many places, both documenting and then trying to make change through policy, legislation. Let's not let governors, let's not think it's only about courts. Talk about governors who could let people out, talk about the executive branch, and talk about legislatures. We have one here, legislators, who could then say, what are the pieces of legislation that could respond to this? And I have to say, on everybody's watch, there hasn't been the willingness to let go of the thing called prison.
Mm-hmm. Mm-hmm. You started talking about solitary confinement, right? That is not the same as medical quarantine. There are studies that have been done that show, however, that in response to COVID rising in detention facilities and prisons, that has actually been the tool used to separate people, right? So can you explain, like, what is wrong with that practice, number one, and why is it ineffective?
Well, for people who've walked into solitary cells, as I'm sure many people who are on your program and many people have been detained in them, they are 4 by 6, 5 by 7, a metal bunk, sink, wet cell with an open toilet, frosted glass if there's light at all. You can be, sometimes it's 24/7 lights on. It is nothing like when people were talking about what it felt like for themselves to be solitary or isolated, as we all need to be and have been and probably will again. Those are not, there's no autonomy choice. You can put someone at great distance and have, first of all, there are actually people do pods of quarantine, as we see, where people are isolated, which are not by themselves, but they've all been exposed. Second of all, you've got to figure out how staffing can come in and out. So you need to have the equipment. And third of all, you don't need to have people not have phones and abilities and access and reading and materials and access to programs through Zoom and the other ways that people are involved. A totally different situation. Now, going back to the merits, there shouldn't be solitary confinement either. And nobody should be sensorily deprived, nor with lights on 24/7.